Welcome to Virtue Podcast, powered by Azkka Pharmaceuticals, India's first company to bring evidence-based flat pricing in medicine. Virtue Podcast brings in renowned healthcare experts as we explore the path to healthier living, where science meets virtuosity. Tune in to YouTube, Instagram, Facebook, and Spotify as we welcome our virtuous guest. Don't forget to subscribe, hit the bell icon for the latest updates, and leave your comments.
The best engineer to be called is the God.
Absolutely.
He has made everyone's heart with the same anatomy, with the same physiology.
So true.
If there are some slight deviations, there are experts like cardiac surgeons. The risk of heart surgery, which was there about 20% 40 years back, it has come down just to only 1%. Cardiac surgeon's job to convince them why they require cardiac surgery. Means at least the treatment is available, and once the heart is fixed, the lifespan of our patient is increased. After minimal invasive surgery, the patient is discharged on the third day itself.
Wow.
Patient is made to climb 2 stairs of the hospital in front of me. A heart transplant is generally done in patients who are having dilated cardiomyopathy. The heart is too much dilated, or ischemic heart disease which has damaged the heart so much there is no angioplasty or bypass surgery option, or if there are damage to all the 4 walls of the heart, in such cases heart transplant is considered.
Could you explain what bypass surgery means in simple words and how it helps patient with heart blockages?
Patient's arteries are not fit for angioplasty, then the patients are referred for bypass surgery. Minimal invasive cardiac surgery is not only bypass surgery. There are wall replacement surgeries. There are ASD, means if there is any defect in the partition. These surgeries are done by minimal invasive cardiac surgery. After the age of 35, every person should get an ECG 2D echo stress test done by a cardiologist, not a technician at an insurance company.
A medical myth you absolutely hate hearing.
डॉक्टर ने जबरदस्ती ब्लॉकेज बोला है.
Hello everyone, myself Dr Shreyas Runwal Gadia, consultant interventional cardiologist at Dr Runwal's Rhythm Heart Care Center, Aurangabad. I and my brother Dr Shreyas Runwal, he is cardiothoracic surgeon. We both have started this institute at Aurangabad. It is a 50-bedded dedicated heart center, and the only motive of this center is that every cardiac patient of Marathwada region should get the advanced cardiac facility in the time required.
Welcome to yet another episode of Azkka Virtue Podcast. When we hear the words heart surgery, many of us feel a mix of fear, misunderstanding, and curiosity. But understanding the person behind the scalpel can help us trust the process more. And that's why I'm specially pleased to introduce our guest today, Dr. Shreyas Runwal, an experienced cardiothoracic surgeon from Chhatrapati Sambhajinagar, Maharashtra. Dr. Runwal is director at Dr. Runwal's Hridayam Heart Care Center. His expertise lies in minimally invasive cardiac surgery, valve replacements, and complex redo surgeries. We are honored to have him here to simplify these topics for all of us. Sir, it's such a pleasure to have you with us for this interaction.
Yeah. Thank you for the honor also.
Thank you, sir. So, sir, I'll move right into the first question. To begin with, when people hear the words heart surgery, एक इमीडिएट जो थॉट आता है वो एक डर का थॉट आता है. So can you, sir, just explain us briefly that what exactly heart surgery really means in general and in what situation it becomes necessary?
Yeah. So heart surgery, yani we are treating the heart.
Right.
Okay. Any ailment of the heart being is to be treated is referred to as heart surgery.
Right.
So in general, people they consider angioplasty also into heart surgery, but it is not as such.
Right.
Heart surgery is the one which is done by the cardiothoracic surgeon, and you have to open your chest, reach the heart, and treat it.
Right.
Okay, if it is bypass surgery for the coronary arteries, or whether it is the heart wall replacement.
Okay. Okay. So I think that makes it so much clearer for all of us. Many of us imagine heart surgery as a last resort, but the way you explained the basics, it actually is a treatment that gives people a second chance at life.
Yes.
So sir, earlier, the heart surgeries used to be considered very risky. I still remember my uncle back in 80s when I would be 4 years or 5 year old was supposed to undergo a bypass surgery that point in time. And though I was very young and very small, but I still remember the kind of fear was there in the family. So in general, we consider it very risky and which involves very long recovery times. How has heart surgery advanced over the last few years, and how are outcomes different compared to what it was earlier?
This is the best, actually, the basic questions what you are going through.
Right.
So, the best engineer to be called is the God.
Absolutely.
He has made everyone's heart
Right.
with the same anatomy, with the same physiology.
So true.
If there are some slight deviations in it, so to treat with it, there are experts like cardiac surgeons.
Right.
For any machine, if you want to repair, there are engineers to get it fixed. So
Right.
to fix your heart, there are cardiac surgeons to fix it.
Right.
So in research and development, in our research and analysis goes on for each and every field,
Right.
whether it is pharma field, okay, whether it is software field, or whether it is medical advances also.
So true.
So heart surgery, when it started, the way of operating was totally different. Okay. So once the advances started, once the heart surgeons started to operate, so they knew some complications. So these complications, once it was found in suppose in 100 patients, so they tried to rectify it.
Okay.
So the risk of heart surgery, which was there about 20% 40 years back, now it has come down just to only 1%.
Wow.
So that's the advancement in heart surgery.
Wow.
Okay. And there are different approaches also. Now it not be key heart surgery is you just have to open the chest. It can be done by minimal invasive technique also.
Okay.
Without cutting any bone. And fear, definitely. There is no treatment for fear. Okay. So relatives would have the fear because everyone is attached to his own family members.
Right.
And heart attack is not a thing which happens routine daily like a fever.
Right.
Okay. So definitely fever will be there, but to make them feel away from the fear. It's the cardiac surgeon's job to convince them ki why they require cardiac surgery. Once the means at least the treatment is available, and once the heart is fixed, the lifespan of our patient is increased. So we should not fear the heart surgeries.
Wow.
That is my say.
Wow. I mean, sir, the statistics itself, which you shared, is so reassuring that what it used to be 20, 30, 40%, maybe say 40 years ago to 1%.
Yes.
I think that is equivalent to any surgery that a person goes through today. So that statistics itself is so reassuring. And I think that removes the fear of the family members or the patient itself. It shows, sir, that how medical science has moved forward from something people used to fear to something that can now be done with much safer results and faster recovery. As you said that now there are techniques also which are involved where there is no cutting off, opening the chest or cutting off the bones. I'm sure that that leads to a faster recovery as well. So, sir, this also makes me curious to ask something that you personally practice, which is minimally invasive cardiac surgery or MICS, as we know. So, sir, can you throw some light on it? That how it is different from a traditional surgery, a bypass surgery, and why it is considered such a big advancement?
Yeah. So heart is situated on the left side of our body.
Right.
Okay. So there are two ways to approach it. One, you can approach it from the center in a conventional form, what means cutting the sternal bone and approaching the heart.
Right.
And the other is you can approach it from the most left side, means between the two ribs, which is a space, intercostal space. From that directly, we can reach to the heart.
Okay.
Okay. So this is the main full form actually, minimal invasive with just 5 centimeter incision, means which is 2 inch. Okay. We approach the heart from the left intercostal space.
Okay.
Okay. And we operate on the patient.
Mhm.
The technique is the same,
Okay.
which is at the lifespan, what would increase, the result is also the same.
Oh.
But we are not cutting the bone. So the pain
Right.
is decreased.
Right.
We're not cutting the bone. So definitely there is less of bleeding.
Hmm.
Okay. Third, patient, if what I convince the patient that on the 10th day, even if the patient wants to go on a world tour, he can definitely go for a
Wow.
world tour.
Oh.
Okay. Or
Ah.
if he wants to go for Balaji temple or Kedarnath Yatra,
Uh-huh.
okay, or even the patient can go to Hajj on the 10th day of surgery
Wow.
if it is done by minimal invasive cardiac surgery.
So, which means that even if you need to go to a crowded place or to the altitudes, so nothing would matter much. I mean,
Definitely nothing would matter because after minimal invasive surgery, the
Mhm.
patient is discharged on the third day itself.
Wow. Okay.
Patient is made to climb 2 stairs of the hospital in
Hmm.
front of me,
Super. Wow.
okay, on the second day itself.
Okay. Okay.
So that's the fitness what we get from minimal invasive cardiac surgery.
Wow. I mean, the idea that surgery can now be done with smaller cuts, as you explained, less pain and quicker healing changes how we think about, heart treatment now.
Yeah.
So it gives a lot of hope to patients who are worried about the recovery part. I mean, this is really amazing. I mean, that on the 10th day, all the normal, activities can be
Yes.
started by the patient. Uh, so, sir, another thing that amazes many of us is heart replacement.
Mhm.
So now I think that has come up. We keep on hearing often now about heart replacement. So could you share what life looks like after someone undergoes a heart replacement, and what kind of care and precautions are needed for this?
Yeah. So heart transplant is mainly generally done in patients who are having dilated cardiomyopathy. The heart is too much dilated, or ischemic heart disease, which has damaged the heart so much that there is no angioplasty or bypass surgery option.
Ah.
Or if there are damage to all the four walls of the heart, okay, in such cases, heart transplant, and in pediatric congenital heart diseases. So definitely in such cases, heart transplant is considered. The advances have gone so much high ki definitely if heart, according to me, it is the most simplest surgery in the department of cardiac surgery.
Wow, really?
Yes, it is just a 40 minutes job for us
Oh,
to transplant someone's heart
Oh.
and give a new life to the patient. And post-operative recovery is as such that he is as normal as any other guy. Okay, because the heart which is transplanted
Mhm.
is definitely, if it is normal, then only it is transplanted to
right, right,
the patient.
right.
Okay, so it gives a very good response in the lifestyle and working of the patient.
Okay.
And definitely for first 6 weeks,
Hmm.
there are a lot of precautions to be taken to avoid infection,
Hmm.
which is guided to by the hospital to the patients. Every yearly, we do cardiac biopsy to see whether how the heart is responding in the new body.
Right.
And there are few preventive medicines also, which are supposed to be taken on annual basis after heart
Okay.
transplant.
Wow. I mean, sir, जैसे we are at a midway of our conversation, but I think you are making it look that, what used to make us fearful.
Mhm.
आपने जिस तरह से अभी बात की है, it looks like, okay, this is something which is very much doable and not much to be worried about. I mean, so I think this is where, the role of an expert really comes in. And I think the way आप कह रहे हैं, it is just amazing. And in fact, not amazing, it's very encouraging. It's really good to know that, with right care, patient can return to a meaningful and active life, even after something as big as a heart transplant itself. So, sir, bypass surgery is one of the most commonly known procedures, but many of us don't fully understand what it actually involves. So, could you explain what bypass surgery means in simple words and how it helps patient with, heart blockages?
Okay, heart is made of muscle.
Correct.
Okay, so its job is to provide blood to the whole body.
Hmm.
So first, for that, he also has to be fit for it.
Absolutely.
Okay, so it requires blood supply by three different arteries.
Mhm.
Okay, so these three arteries, if they have blockage, then they are needed to be treated. So there are two ways of treatment: either angioplasty, which is balloon stent,
Hmm.
and the other is bypass.
Right.
If it is not possible from by angioplasty, or if the patient's arteries are not fit for angioplasty, then the patients are referred for cardiac surgery,
Hmm.
bypass surgery, coronary artery bypass surgery, CABG.
Hmm.
Okay. So if any road gets blocked, what the government does, they join the first and the second point
Right.
outside the city.
Absolutely.
So that is called as bypass.
Right.
So it's the same way. We do not
Yeah.
touch the blockage.
Oh,
Okay.
okay.
The new artery, the new vein supply
Hmm.
is supplied to just ahead of the blockage, the
Oh,
previous blockage. This is called as coronary artery bypass surgery.
okay.
So even if that 90% blockage gets 100%, we did not worry
Hmm.
because we have already established a new pathway.
Okay.
मीन्स फर्शीपुर गिर गया तो भी कोई प्रॉब्लम नहीं है,
हाँ,
क्योंकि गवर्नमेंट ने नया ब्रिज कर दिया है, तो डॉक्टर ने जब नया रास्ता बना दिया है तो
हाँ,
लाइफ स्पैन आपका डेफिनेटली बढ़ चुका है.
हाँ.
So I suppose the lifespan increases by 15-20 years minimally.
Wow. Okay. So, sir, as I understand, bypass is a very done conventionally where you open, through the sternum and it's open heart surgery.
Yeah.
Whereas I take back you to the previous question about the minimally invasive cardiac surgeries.
Right.
So, are there any specific criteria about the patient where, okay, these patients are only eligible for minimally invasive cardiac surgery? These are the set of patients who are eligible only for bypass surgery. How do you go about it?
Yeah. As of now, we provide bypass surgery to means by minimal invasive to each and every patient. Okay, that option is given to each and every patient coming to my door.
Okay.
Okay. But minimal invasive cardiac surgery is not only bypass surgery. There are wall replacement surgeries.
Okay.
There are ASD, means if there is any defect in the partition, heart wall partition, then these surgeries are done by minimal invasive cardiac surgery.
Okay.
But if there is a major surgery involved, like of aortic dissection, e.g., जो बड़ी आर्टरी हार्ट से निकलती है वो पूरे शरीर को सप्लाई देती है, उसको एओर्टा बोलते हैं।
राइट।
यदि उसको डिजीज है, यदि वो फट जाता है तो तब मिनिमल इन्वेसिव कार्डियक सर्जरी वी अवॉइड। वी ट्राई टू डू इट बाय कन्वेंशनल वे बिकॉज वी डोंट नो कि हाउ एक्सटेंसिव डैमेज okay
Right.
it has done to the body.
Okay. So, sir, is age a criteria when you go about
Age
it or
is
not?
not a criteria for
Okay.
anything. Any age group,
Okay.
any weight group can go for minimal invasive cardiac surgery.
Wow. Okay. I mean, the way you explained it, like creating a new road
Mhm.
when the old one is blocked really helps us understand, and it is a literal meaning of bypass.
Right.
So that is what
Right.
happens and saves so many lives. So, sir, apart from bypass surgeries, there are many other types of heart surgeries as well. Could you give us some overview of, typically what kind of patients usually come to you and what are the heart surgeries apart from bypass surgeries you
So
perform?
there are a lot of advancement has gone through in the Department of Cardiac Surgery. This field has exposure of first coronary artery bypass surgery, as we have discussed. Second, there are 4 chambers in the heart. Okay, there is partition in between them.
Hmm.
If any chamber, any partition is having a hole, okay, that hole closure
Hmm.
is a part of cardiac surgery. Then there are walls. So the replacement of these walls change if these walls get damaged. So this is called as heart wall replacement surgeries. Okay. Then there are some congenital anomalies, means some kids who are born with some deviation in the structure of the heart. Okay, so there are around 24 to 20, 24 surgeries which can be done in congenital heart diseases.
Wow. Okay.
That's the thing.
Okay.
Then replacement of the aorta
Hmm.
is done if the aorta size is big, or in some high BP patients in with these aorta get split up.
Hmm.
So in aortic dissection also, that is also a scope of this cardiac surgery field.
Wow.
And I'm happy that cardiac surgeon has gone into a hybrid surgery process also.
Right.
What is hybrid surgery? I would just like to explain, and because if some patient wants treatment of a patient first to some extent is not fit for totally for minimal invasive cardiac surgery, then we do hybrid surgeries also. Means 2 arteries are bypassed with minimal invasive, and the third artery which is not approachable through minimal invasive approach, we take the patient to the cath lab after the surgery and insert a stent also. So this is called as hybrid thing.
Wow.
A
Okay.
combined operation done by the cardiac surgeon as well as the cardiologist.
Wow.
This is just a heart team approach for the all overall safety and desire of the patient.
Wow. So, sir, as you said, the hybrid surgery happens on the same day or it is scheduled or pre-planned accordingly?
Yeah, it is pre-planned, actually scheduled. Like first, the open heart surgery process is done,
Right.
and when the patient is taken up for the third stent, actually in the cath lab, at that time the bypass thing is also rechecked
Okay.
by a
Alright.
recheck angiography
Wow.
at that time.
So even cardiac surgeries have now hybrid models. For the first time, I got to hear. That sounds really amazing, and that's sir, eye-opening to realize that uh, heart treatment is not like one size fits all. I mean,
Mhm.
there is such a customized approach, as I gather from what you are saying, that there are many options depending on the patient's condition, and that definitely reduces the fear and the confusion, which is the major thing. So, sir, before reaching the stage of a major surgery, regular health checkups can make a huge difference. So, sir, can you tell us why heart checkups are so important, and what kind of tests people should do regularly? Because there is a lot of confusion within this. Because one data point or maybe a one simple test cannot define the healthy heart. So, in and around, sir, if you can share that, what exactly we should go about it.
So there is no age group restriction actually to get a health checkup done. But what I feel ki after the age of 35, every person should get an ECG, 2D echo and stress test, treadmill test done by a cardiologist, not a technician by at an insurance company, but at a heart center from a cardiologist. So this helps us to pick up the blockages at an earlier stage.
Right.
If the patient gets an heart attack, okay, so it will damage the heart.
Right.
And if the heart is damaged, so even if the heart is damaged, we will insert the stent or we will do a bypass. But if we get it checked at an earlier stage, so and electively angioplasty or bypass is done for the patient, patient's heart will work as normal as it was previously.
Right.
Okay, so damaged heart will function 30% less. The symptoms will be there to the
Right.
patient. So definitely, annual health checkup is recommended. It is compulsory outside India to get a CT angiography done, but that is not practically possible to get it done for each and every citizen in India.
Right.
But stress test is reachable even at taluka places. So definitely we should get it done annually.
So, sir, after this wonderful conversation, as we are reaching towards the end, we thought to add a fun part to it, which is rapid fire round. I mean, all the talk shows we see rapid fire round happening. So we thought, why not take this liberty and have a rapid fire round with the best in cardiology? So, sir, are you ready for it?
Yes,
So we have to make it rapid and with a lot of fire. Yes? All
for
right.
sure.
Yes. So here it goes. One health habit you swear by yourself.
30 minutes of yoga.
Wow. A medical myth you absolutely hate hearing.
Okay. डॉक्टर ने जबरदस्ती ब्लॉकेज बोला है.
Stethoscope, BP machine, or prescription pad. Which one feels most to you?
My favorite, stethoscope.
Wow. Have heart cases increased after COVID?
Yes, definitely.
Okay.
Heart cases have increased and the age group pertaining also has decreased.
What's tougher, treating patients or convincing them to change lifestyle?
Definitely changing their lifestyle.
I'm sure. One guilty pleasure food you can't resist.
Pani puri.
Wow. So, thank you so much, sir. This brings us to the end of this such inspiring and a wonderful conversation. Thank you so much for this insightful discussion, from understanding what heart surgery means to the latest advances like minimally invasive cardiac surgeries, heart replacement, bypass, and the importance of prevention. We have covered so much today. I think the biggest takeaway is that heart surgery is no longer something to fear, but something to trust when needed. Remember, every heartbeat matters. So live well, live healthy. Thank you so much for joining us, sir.
Thank you.
Thank you.